Hi everyone and welcome to this another interesting topic of thoracoabdominal diaphragm. I'm Dr. Ankit Khandelwal and let's take a quick look into this important topic. So let's start over here and here you can see the two views over here. Here on the left side you have anterior view and this side we have the lateral view. So this diaphragm, thoracoabdominal diaphragm, is actually a group of muscles which is separating the thoracic cavity above from the abdominal cavity below. And the muscles you can see are lying on the periphery with the central tendon area in the center. That's a different point. So this diaphragm over here, or this group of muscles, is actually overlapping the liver, the stomach, and the spleen and the kidney from below. It's shaped like an umbrella. The development of it is actually starting from the neck, and due to this, the reason of it being supplied by the phrenic nerve, okay, whose root value is actually C3, C4, C5. So as development comes from the neck, so its motor supply is from the phrenic nerve. The sensory supply will be from the phrenic as well as from the intercostal nerves. Okay, so remember this, intercostal nerves supplies the sensory and the phrenic nerve is mainly motor. Okay, so this is the overview, and if you look at the lateral part over here, this is the lateral view aspect, the left lateral view. The red bold line is actually representing the diaphragm, and here you can see the different this shape like umbrella, as I already told. And there are three major openings. This blue one over here is the IVC opening, which you can also see in the anterior view. This brownish one is actually the esophagus, and the red one obviously will be the aortic opening. Theoretically, we have to remember that the IVC opening is lying at the level of T8, the esophagus at the level of T10, and the aortic opening at the level of T12. We have very famous mnemonic like I8, 10 eggs at 12. So it shows that IVC at T8 level, esophagus at T10, and aorta at T12. So these are the three major openings that you need to know. But considering the level of exams, we have other openings also, and here we can look at this particular image. Here what we are seeing is the diaphragm again, and you can imagine it that you are seeing it from above, and the central diaphragm, also central tendon of the diaphragm, is this tripod leaf shaped structure over here, and all around we have the muscles part over here. Okay, the numbers over here are showing us the 7, 8, 9, 10, 11, 12. That are the ribs over there. Okay, so if we talk about the three major openings to begin with, first of all, let me orient you to diagram. This is the anterior aspect, that is the posterior aspect, and the center we have the tendon. And if you look at the three major openings, we have the vena cava opening over here, we have the esophageal opening, and we have the aortic opening. The levels we already have discussed: the vena cava at T8, the esophagus at T10, and the aortic opening at T12. There are other structures which also pass along with these openings over here. Like for example, at the vena cava opening, we also have the location of the right phrenic nerve. Along with esophageal opening passes your left gastric vessels as well as your vagus nerve also. Along with the aortic opening, you have the thoracic duct and the azygous vein. So these three main openings should be clear to everyone. So IVC opening you can see in the central tendon. This is the esophagus opening in the muscular part, and the aortic opening over here that lies behind the median arcuate ligament. Now apart from all these major openings, there are other structures which also will pass through it. For example, I'm highlighting over here. This one is the superior epigastric vessels that are passing anteriorly. Similarly, we have these two ligaments, median and the lateral arcuate ligament. Through the medial arcuate ligament passes the sympathetic trunk, and through the lateral arcuate ligament passes our subcostal vessels and nerve. Apart from this, we also have the right and the left crus of diaphragm over here. And what passes through this left and right crus of diaphragm are basically our splanchnic nerves. Splanchnic nerves are basically a part of sympathetics. Okay, so these are the other openings that we need to understand apart from the three major openings. The last image I want to show you this cadaveric image over here of again the diaphragm only. Okay, we have this cadaveric image of the diaphragm, and again this anterior aspect over here, the posterior over here. It's looking at the diaphragm from above. So this part is the central tendon of diaphragm. And this being the right side, this thin walled structure is IVC, and this thick walled on the left side is basically the aorta. And esophagus will obviously be collapsed, and therefore this structure over here is the esophagus structure over here. If you remember that we discussed that along with the IVC opening, we have the right phrenic nerve also, which is right over here. This structure is the right phrenic nerve. Okay. If you're wondering where is the left phrenic nerve, then this structure over here, this is the location of the left phrenic nerve. Behind, we can very well see the vertebrae over here, the thoracic vertebrae over here, and in this structure we have the spine cord over here. This is a cadaveric image that gives a good idea. These are all the openings, the major and the minor ones, their levels also, and here is an overview of the diaphragm. Normally one question do come from it. Also do look at the embryology of the diaphragm also, that is also very important. I hope you liked it. So that's all. Revise, keep on revising, and all the best for the exam.